I've been having pain in my knee joints for the last 2 years, and this problem has been aggravating a lot. My knee doesn't look deformed like the rest of the people. It's not bent, it is straight, but I still have pain on the inner side of the knee. Especially when I'm trying to go for my walks, I'm unable to go and walk more than a kilometer. Whenever I'm climbing stairs, I'm having a problem. When I sleep in the night, I have a problem. So these are the symptoms that we will see mostly when patients who have an isolated medial compartment osteoarthritis. What we mean by this is the inner part of the knee gets damaged and the rest of the knee is normal. So only one part of the knee in against to the three parts of the knee have a problem. In such a situation, we have an option which is become much better and has great advantages in terms of longevity, that is the lifespan, known as the partial knee replacement surgery. This surgery, we only replace the part of the knee that is damaged. So what happens is you have the natural knee, you have the natural ligaments, and most of your knee is able to perform like how it performed when there was no problem in the knee. So you get a very natural knee just by changing one part of the knee joint. And today, the biggest advantage that robotics has created in knee is for partial knee, because partial knee replacement with robotics has caused the alignment and the way we put the implant to be so accurate that it lasts for about 15 to 20 years as compared to what it was 8 to 10 years earlier before the advent of robotics with partial knee. So this is the biggest advantage of robotic with partial knee replacement. Patients can walk within 2 weeks without a walker, and they can do their jogging activities in about 2 months after doing the surgery. So partial knee has a very fast recovery and very good outcomes with robotics.